Hospitals in Nebraska are facing immense inflationary pressures since the COVID-19 pandemic. Due to rising costs and staff shortages, over 55% of hospitals nationally are operating in the red. Supplies are up 20%, prescription drugs 40%, and overall expenses are 20% higher compared to 2019, according to the Nebraska Hospital Association. NHA President Jeremy Nordquist says hospitals feel handcuffed with rising prices due to their inability to significantly increase dollars coming in.
A lot of businesses would say, well, we got to adjust, we got to raise our prices. The challenge with hospitals is most of our revenue is fixed. Most of our revenue, depending on the hospital, 60 to 80% of the money that comes in the door is from Medicare or Medicaid, the two government payers. And those amounts that we get paid to provide a service are set.
CEO of Pender Community Hospital, Laura Gamble, says the problem is compounded by recent levels of inflation.
Medicaid, Medicare, we're getting paid less for the care that we give. And so you look at the rate of inflation and what we're getting paid back from these payers, it doesn't, it doesn't come together.
CFO of Columbus Community Hospital, Chad Van Cleve, says he feels the government isn't paying their fair share of the reimbursement, and he'd like to see more going back into the system for frontline workers in Nebraska hospitals.
Will the federal government, will the state government step forward and recognize and reimburse those frontline care providers?
The NHA plans to introduce several bills in front of the legislature to help reduce the stress level of hospitals across the state. Many are aimed at fixing another long-term concern, adequate staffing.
We have a couple packages before the legislature this year to try to really jumpstart the pipeline of nursing in our state. We can get folks into our community colleges, go through a 2-year program. They're a registered nurse at the end of that program.
Throughout the COVID-19 pandemic occurred a mass exodus away from nursing, with healthcare administrations saying many workers were concerned for their own health and families' well-being. Now, healthcare leaders turn to create more ways for nursing to appeal toward young people.
It takes a team, and unfortunately, I think the challenge for Nebraska and in the United States, to be honest with you, is the lack of people getting into our career field, because it is difficult. And when you throw that on, not wanting to reimburse and not wanting to pay for those skills, that's where the challenge is. That's what I feel the future of healthcare will hang upon.
If the ongoing pressure continues, the NHA says many rural hospitals could be forced to cut programs. Pender Community Hospital Rural Clinic Director Lori Miner says a nearby hospital that isn't equipped to deal with the variety of issues could have major consequences.
Because I think people would not get the care. I think we would see the mortality rate would go up. I don't think that they would wait longer before they went to a provider when they know they'd have to drive an hour. They would be, especially the older population.
The NHA will now look forward to appearing in the state capitol addressing these issues from a legislative level.
So it really has to be policymakers prioritizing rural health care if we're going to be able to keep and sustain the services that we have.
Peyton Thomas for News Channel Nebraska.